All right, folks, we're going to go ahead and get started. First of all, thank you all for coming out. My name is Bruce Mattare. I am one of your county commissioners. Before we start the event tonight, let's do the Pledge of Allegiance. So if you could all stand up, face the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Great, thank you. You can be seated. Welcome all to tonight's Veterans Town Hall. I would just like to acknowledge a couple of folks here. We have our sheriff, Bob Norris, in the back, and we have the president of North Idaho College, Mr. Swain, back there. So if you could just give him a quick round of applause there. Let me tell you what to expect tonight. We have an all-star panel up here of folks from different components of veterans benefits and services. We're going to discuss what they do, and we're going to get answers to your questions about how the benefits work, what can be done to make it better, and why some things are the way that they are. And just what I'd like to do real quick, a lot of people don't realize that this community has a lot of veterans in it. And I just want to give you some stats from this community. In 2023, the estimates put the number of veterans living in Idaho at 128,000, which is pretty significant for a state that I think we just hit 2 million in total population, so more than 5%. It represents 10% of the adult population. In 2023, the VA estimates that Kootenai County veteran population was 16,211. However, the annual growth estimates at this point have put it closer to 20,000. Despite Kootenai County being the third largest county in the state, we have the second highest veteran population. And the VA total exposure, or expenditures, I should say, for Kootenai County is about $210 million. So it's $210 million that the VA that sends into this county through various forms of payments and so forth. So that's a pretty significant sum of money. We have a office here, and I'm going to talk a little bit about that helps a lot of veterans. And the percent, I just want to break this down. We still have World War II veterans that we're helping, about 6% of them. They're mostly coming in for hearing loss and pension issues. We have Korean War veterans that we're helping. It's about 7% of the caseload. That's, again, for hearing loss and pensions. About 39% of the caseload comes from Vietnam vets. Hearing loss and Agent Orange presumptives. 16% are from the Gulf War or the Operation of Enduring Freedom or Operation Iraqi Freedom, about 16% there. 30% are peacetime, and let me go back to the Gulf War, folks. The largest form of treatment is PTSD or the PACT Act. For those of you not familiar with the PACT Act, it expands benefits to toxic substance exposures. It's a pretty significant issue, I think, now with the more recent wars that we've had. Peacetime is about 30%. Again, hearing loss, sustained injuries. And about 1.5% are survivor, dependency, and indemnity compensation and pension issues. Now, there's another organization in this community that I think is worthy of mention. How many folks are familiar with an organization called New Beginnings? Yeah. They do amazing work. Teresa started that, Teresa Hart. Their mission is to provide resources, and I'm giving this information too for the folks who are watching from home so that they can be aware of what's out there for veterans. They provide resources, referrals, and essential personal and household items to veterans, active military, and their families, as well as Gold Star families, at absolutely no cost to them. All that is required is proof of military service, past or present, for the veteran or a household family member. This amazing service is done through nothing more than donations and fundraisers. They never charge the veterans or their family members for the donated items. There are no price tags and there are no cash registers. The veterans are able to shop for free for what they need, with no income eligibility requirements of any kind, of proof or of need of necessity. They currently have 6,900 veterans from Kootenai County and Spokane enrolled in their program. They serve 150 to 200 veterans each day with 130 plus active volunteers, 15 to 20 per day. Their volunteers put in 29,000 hours last year. And they just started a capital campaign to raise money because they've been outgrowing their space. And I can tell you, I've known Teresa from the very beginning. She has outgrown her space every place she goes to. I mean, like, as soon as she moves in, there's no more space left, and she's already outgrown it. And the last place, or the one she's at right now, is huge, and she's outgrown it. It's amazing. What she has been able to build and provide for families in this community is unheard of. It's amazing, and I hope it's a model for other communities in this nation, because it's extremely important how we take care of our veterans when we ask people to sign that dotted line and become a member of our military services. What I'd like to do is just introduce each of the folks up here on the panel one by one, and then have them talk a little bit about their organization, what it does, how it came about, how it serves people, and just give the folks here and watching at home an understanding of what they're doing. So I'm going to start with, and I'll just read a quick little bio of each of them. I'm going to start with the gentleman closest to me and work across the table furthest from me. The first person is Jake Faulkner. He's the director of the Idaho State Veterans Cemetery, a U.S. Navy vet, served as a Master at Arms and an NCIS special agent, a decent fly fisherman, which is a category. I didn't realize that. You know, at first I thought like it was a self-proclaimed, I'm a decent fly fisherman, but it actually is a category.
Certified.
Yep, it's a certification. Enjoys long walks in the woods during hunting season, which I would imagine is more of a stalking activity.
No, I'm just looking.
No? Okay.
More of a walk than a...
So, but if you could just go ahead and just talk about, you know, what you're doing and who you're serving, how you're doing it, and all that good stuff.
Yeah, thank you. Thank you all for being here today. I am from the great state of Ada County, and we have the Boise Cemetery. It's our largest operation. We also have a cemetery in Blackfoot, which is established in 2020 and is slowly growing in popularity. We inter veterans from all over the nation. It's not just a Boise area or Blackfoot area. We get veterans from Florida, Texas, all over the place, including northern Idaho. We serve all veterans. It doesn't matter what your driver's license say. We've grown tremendously in the Boise area, especially since 2020, of course, and we recently just bought 14 additional acres adjacent to our property, so we're expanding. We're working with the VA on a VA expansion grant, and I'll touch on that more later, but the VA will fund that, and we'll be able to inter veterans for the next 80 to 90 years with that. And I work with the Idaho Division of Veteran Services.
Thank you, Jake.
Yeah.
Next up is Mitzi Sheldlin, and Mitzi is the director of the newly established Veterans Outreach and Community Support Bureau at the Idaho Division of Veterans Services. The VOCS team helps veterans access resources and build community partnerships to support every Idaho veteran, regardless of their specific needs. Veterans have given her the nickname, and this is true, Fairy Godmother. So, Mitzi, take it away, please.
Thank you. Veterans Outreach and Community Support, as you mentioned, a brand new bureau within the Idaho Division of Veterans Services. Everything else that didn't fall into a category now falls into my category, and my boss, Mark Champ, will talk about this a little bit more, I'm sure, but it's been 4 years now, ago when he started, he said, I don't want any veteran to ever call the Idaho Division of Veterans Services and have us say, we don't do that. We do a lot for veterans, but there is a lot of areas that just don't fall into any category, and so that falls to my team. And I honestly and truly believe to the depths of my heart that there is help for every veteran. Sometimes that help is telling the veteran no, but not just, no, we can't help you. It's, no, we can't help in this way, but let's figure out how we can help you. And it may not be the direction that they were intending on going, but we can assist them. And most benefits, health care and things, you need to have an honorable discharge. I'll work with anybody under any circumstances, no matter how long you've served and what your discharge is, because we don't know what the rest of the story is behind that. And so that's my job. And like I said, they have nicknamed me the fairy godmother, because I am not the person necessarily that's going to create a miracle, but I've got that magic wand that can point at new beginnings or organizations like that can help. And veterans, when they're out in the community, have never sought benefits or anything before, they have no idea where to turn. So that's what I do.
Thank you, Mitzi. Okay, next over is Sarah Boardman. And Ms. Boardman began her VA career in 2009 in San Antonio, Texas, and served in various administrative roles, and now in the Pacific Northwest. In her current role, Sarah maintains responsibility for administrative operations, including engineering, finance, healthcare administration, police, supply chain management, environmental management, and voluntary services. She is and I hope I got this correct, the Associate Director of the Spokane VA Medical Center. So Sarah, if you could please just talk a little bit about all the different components of, basically running the medical center.
Yeah, thanks for having Man-Grand staff be a part of this. Thanks for the opportunity to participate with this panel. Our healthcare system is responsible for delivering healthcare both directly and in the community, and a lot of other services to veterans across 64,000 square miles of southeastern Washington, North Idaho, as well as western Montana. We have a number of different clinics strategically placed across the region to provide those services, and I would say that probably the most creative part about this work is trying to understand, as the responsibilities and scope change for what we provide to folks, how we can do that best, and understanding the resources available to us. It's partnerships and events like this that really allow us to tap into areas that we're meeting those expectations and some that need some work. And so we have a really talented group of individuals here this evening as well that have tremendous experience to help address things that would be of interest to this group. So it's a real pleasure to be here. Thank you.
Well, thank you so much. Next over to Sarah's left, your right, is Mark Champel. And Mark is a combat veteran who served as a commander in the U.S. Air Force. He led a 300-person security law enforcement squadron. He was deployed to Iraq as part of Operation Iraqi Freedom. Mark has a master's in health and human performance from Iowa State University. In 2021, Mark was appointed by the governor of Idaho as the chief administrator for the Idaho Division of Veterans Services, where he continues to work serving fellow veterans. And if you could talk a little bit about your department.
Yeah, thank you. So I'm the director for the Idaho Division of Veterans Services, and the best way to think about that is state VA. Sarah's federal VA, we're the state VA, which is completely separate from the federal VA. But what we do is we provide services to veterans on behalf of the state of Idaho, but then we also work very closely with the federal VA on many, many programs to make sure that our veterans are completely covered and that they get the benefits that they've earned through their service. We do that in 5 main areas, and actually 4 of those areas are represented by my staff up here. So we have Jake in our State Veterans Cemetery, where we honorably inter our veterans and their spouses. We got Scott over here, who represents our Office of Veterans Advocacy, and those are offices throughout the state where any veteran or their spouses can come in and we'll help you with your benefits. Make sure that you get your benefits, and everything we do that's 100% free. There's no charge for that, and nobody ever should charge you for you getting your benefits that you've earned. We've got our state veterans homes that we have 4 across the state, and obviously our newest one here in Post Falls that's managed by Amber, who's next. And then we also have an education department that's in charge of certifying all of the programs in Idaho that our veterans can use their GI Bill on. Right now we have almost over 4,000 different programs that our veterans can use their GI Bill on, or their dependents. And that number's growing every year to make sure that, again, our veterans can use those benefits that are available. And last but not least, our newest section, which Missy runs, is our Office of Veterans Outreach and Community Support. And we created that specifically to be a stopgap, because we recognize that not every veteran falls into the 4 other categories that we provide services to. And like Mitzi said, I wanted to make sure that even if it wasn't a service we provided, I wanted to make sure that we were involved in making sure we warm hand off any veteran or their family member to another organization, I think a lot of who are represented here in this room right now, that can provide that service or that aid that that veteran needs. Because again, the idea is we don't want to turn any veteran away or their family members away. There's somebody in the state of Idaho who wants to help that veteran, that has the resources, that has the personnel, and all we have to do is connect them to that person. And that's what Bitsy does. She literally travels the states, making networks, connecting people, and she does have a magic wand that whatever it is that's needed, and honestly, if you get a chance, let her tell you some of the stories, but whatever the need is, she can connect that veteran or that family member to somebody within the community of Idaho who wants to help that individual. And like she said, it's not always what you might think it is, but it's always what they need. So again, we want to make sure that we're covering absolutely everything that we can, that no veteran or their family members are turned behind, and we do that through those 5 different programs.
Thank you, Mark. Next over is Amber Goodchild. She received her Bachelor of Business Administration from Baylor University and has been a licensed residential care and skilled nursing administrator since 2019. For the past 15 years, she has worked in many roles for the Idaho Division of Veterans Services, with the past year and a half serving as the administrator of the, and this is a pretty cool facility, Post Falls Veterans Home. So can you talk a little bit about that?
Thank you for having me part of your panel. I am the home administrator of the Post Falls Veterans Home. I have the privilege of caring and serving our veterans, and my team of 80-plus individuals get to make sure that all of our veterans are honorably and have dignified care as they need that towards that medical management as they're nearing the end of their lives. It is a skilled nursing facility, so you do have to have doctor's orders to live there. It's a 64-bed facility, and there is no restrictions for who can live there besides having those orders from the doctor and be an honorably discharged veteran. There's no income restrictions on that. I know that there's a lot of questions about the income eligibility for that. If you are service connected at 70 to 100%, the VA does cover your care of costs. But if you don't have that 70 to 100% disability rating, my team will help assist with other financial avenues to ensure that you can live there and get the care that you deserve and need.
Great, thank you. And at the end, on the far right, is Scott Thorsness, and he provides technical assistance in obtaining a wide range of entitled veteran benefits side for the Idaho Division for Veterans Services. And if you'd like to talk a little bit, Scott, just about what you do and how you serve veterans.
Sure, thank you, Commissioner. And again, thanks for having us here. First, born and raised, Coeur d'Alene, so local. Yes, I work for the Idaho Division of Veterans Services, the Office of Veterans Advocacy. So our primary role is to help veterans understand, obtain, and apply for VA benefits or other state and federal benefits that may be available. It's a difficult path for some, because when we read these things, they can be confusing. But that's why we have a team of individuals to be able to help. I have another service officer in my office with a wonderful assistant, Amy, which many of you may know. We also work in coordination with and/or for our county and post-service officers. So we are one team, one fight. And every one of our service officers I know of up here diligently and want to assist every veteran or their family member in those claim processes. Yes, thank you for being patient with us, as they can be difficult. Developing a claim can be difficult, but that's why we're there. We're to help coach, counsel, and put together a winning claim package so we can show the VA what we already know. So we have moved our specific office for Idaho Division of Veterans Services, OVA, in Post Falls. We are located in the veterans' home. We were with the Kootenai County folks. I just want to let that out there because some people still may not know that. But please come to our office, give us a call. We want to help you, and we want you to get the benefits you deserve. And we will do everything we can to make sure that happens. Thank you.
Thank you, Scott. Now, besides Mark and Jake, is there anyone else that came up from Boise? Oh, Mitzi, you did? Okay. Well, welcome to North Idaho. I'm sorry the weather's a little cooler than it should be.
Perfect.
But, you know, when you go back, trust me, it gets much nicer as the year progresses. So thank you for coming up. I'd also just like to mention that Kootenai County has a couple of additional programs for veterans. We have a Veterans Affairs office, and the gentleman that runs that back there in the red shirt, Tom Freeman, it's a free resource for veterans. It's funded by Kootenai County. The division or the department reports to the Board of County Commissioners. It's a resource and helps to advocate, to help navigate the VA system, so you get the benefits that you're entitled to. The office excels at providing information and assistance in preparation of VA claim paperwork, and they answer VA benefit questions and can direct you to resources that can help you successfully navigate through the Department of Veterans Affairs and other entities. And the office is comprised of all veteran employees. I'd like to just tell you a little bit about Tom. Sorry, Tom, I'm going to put you on the spot some here. Tom served both in the enlisted ranks and as an officer in the United States Marine Corps, where he retired as a Chief Warrant Officer 4. His service spanned 30 years as an operations planner, company commander, and a maintenance and logistics officer. During his career, Tom had multiple combat tours in Iraq and Afghanistan. He also spent time in the DMZ in South Korea and participated in operations in the Philippines and Thailand. Tom served aboard the USS Bellewood and USS Tarawa. Now, I've spoken to Tom about a lot of issues that he helps to solve for veterans. And he goes about it, and he knows his stuff. And I know that because I've had to deal with the VA before, and it's a labyrinth. It's easy to get lost and mired in there. And Tom has the magic phone numbers where he can get the information and cut through the tape, if you will. So I would encourage every veteran, if you don't know who Tom is, you don't know about our Veterans Affairs office, please contact it. And it's over in Post Falls. And I also just want to make a quick mention. The Board of County Commissioners started and approved a veterans court, a treatment court, where it actually provides specialized benefits and services for veterans to help them get through the court system, those who do get wrapped up in it, and also to find creative ways to work with the veterans and help them out. So it's a fairly brand new court. It's just happened within the last year. With that said, let's go into some questions. Okay. I have some questions that were from the stand down from last week that were provided. So I'm going to ask whoever would like to take the question, just go ahead and raise your hand, and we'll go ahead and do that. First one, about healthcare. Do all veterans qualify for VA healthcare?
Not every veteran qualifies for VA healthcare, but there's a lot of opportunity to get folks engaged with care. We have a really talented team in our eligibility section, augmented by staff in a lot of other areas to help individuals understand what they qualify for. Service connection status, sometimes income can factor into those determinations, but there's been a lot of efforts over the past handful of years to make sure that veterans get the care that they need at the time that it's needed. And in some circumstances, some of the eligibility determinations are figured out once we get folks engaged. So it's really important to understand what that looks like on an individual level, because there's considerations that factor in for copays, for medications, any number of things. And it is a really complex organization with a lot of people and different teams to help. So I would encourage folks that haven't yet had an opportunity to explore their eligibility to engage with our team. We've got Trey here with us tonight that can help with that. And we've got a number of forms too for individuals that would like some outreach after the event, because it can be a little tricky to navigate and really intimidating when you come in the doors sometimes.
And so there are a number of VA employees here that can help answer questions if you have questions. It does seem like one of the challenges is that when folks get out of the military, they kind of just move on, and they don't really check to see what they're eligible for shortly afterwards. And then 20 or 30 years goes by, and then they want to take advantage of these benefits. And you almost have to start from zero again to reconstruct if something's not there. Because oftentimes the veteran says, I was due this, I did this, I was here. And yet it seems to be very challenging to kind of establish this benefit category. Is that something that you see a lot?
I think probably a number of us could touch on this, because it's usually any number of circumstances that prompt somebody to become curious about this, whether it's establishing a service connection through Veterans Benefits Administration, or if it's some sort of acute medical condition or a change in just personal circumstances. So there's been a lot of partnerships over the years that Trey could probably speak to as well, about creating that engagement at the time that folks separate from the military, kind of building on legislative changes that look to expand that. And we're always learning from those. So I think that we've got a number of team members that can help bridge that gap when we become aware of certain pockets or places or other community coalitions that we work with that can help bring awareness to that, because it can be complicated.
Yeah. Would anyone else like to add to that?
I was just going to add, I think one of the things I encounter most are veterans that say, I don't want to take benefits away from anybody else. I'm good. I don't need to make sure my buddy's taken care of and things. But your benefits are your benefits. You earn them for your service, whether it be 2 years, 20 years, whatever, and you're entitled to those. And it's not going to take anything away from anybody else. It's actually going to enhance services for other veterans, because the more people that are enrolled in healthcare at our hospitals, the more people that are applying for benefits, the more people we are able to hire both at the VA and Idaho Division of Veterans Services to take care of you. So if everybody just sits back and says, well, make sure my buddy's taken care of, you're doing a disservice to your buddy. And then on the other side of that, too, some benefits, and we'll get into this, there's probably some questions about this, carry over after you pass away. So if you don't apply for your benefits, you're not taking care of your spouse when you're gone either. So, and that is not for everyone, but some benefits do follow you after you pass away. So everybody needs to at least check and see what your benefits are. Both, and I'll point out on the slide up here for the VA, we say VA just in general, but there's 3 areas of the VA. You've got VHA, which is Veterans Health Administration. That's the hospitals and the health care. And then VBA, Veterans Benefits, and that are your claims and other benefits that you receive, you know, VA home loans and things. And then the Cemetery Bureau, Veterans Cemetery Administration, and Jake can talk more to that. But just because you've gotten health care at the hospital doesn't mean that you filed a claim for compensation, or just because you're receiving compensation for a service-connected injury, you may be 100%, but if you didn't go to the hospital and enroll in health care, you're not getting your health care from the VA. So again, there's all these different areas and things that you need to consider.
Trey's in here, right? Trey, where are you at? Right there. So
He'll be back.
this sounds scary and complicated, but the VA has eligibility specialists that you can sit down with, and they will help you navigate that system. So you don't have to figure it out on your own. Go to the VA, check in with Trey or whoever the eligibility specialist is, and they'll help you navigate that system. And honestly, their job is to help you get care. The other thing I want to say really quick is that with the PACT Act passing, there are a lot of veterans who weren't eligible for health care previously that are now eligible for health care now. So even if you have gone to the VA before and they said, sorry, you're not eligible, I want to encourage you to go and check again. Because again, with the PACT Act passing, many, many, many more veterans are now eligible for health care that previously weren't. And the only way that you're going to find out is go talk to Trey or whoever his eligibility specialist is, whether it's here for Spokane or Walla Walla or Boise or Salt Lake City, right? They're there to help you navigate that system. And again, they're going to ask you a whole bunch of questions, but they'll help you figure it out. And they're also going to help you navigate that system. And again, their role is to get to yes. Yes, we want to care for you as a veteran. And again, I want to double, triple, and pound what Mitzi said. The more veterans that use these services, the more money that is going to get put into those services, not only for you, but for your fellow veterans. So again, you know, our Vietnam vets, I don't need anything. I don't want anything. All right, don't do it for yourself. Do it for your spouse who can get some benefits, or do it for your fellow veteran who needs those services. Because again, the more you tap into that system, they track all that. And if they see usage increasing, guess what they're going to do? They're going to increase funding. They're going to increase the clinics that are out there that you can go visit and get care at. So it's very, very important that we all collectively as veterans go and seek out the benefits and the services that you've earned through your service.
So what it sounds like is that you should periodically be checking your eligibility for benefits. But when should a veteran start to check their eligibility for benefits?
Today.
First thing the veteran need to do when he first get out of the military is come to the VA hospital. A lot of veterans came in, do not know they should be trying to come to the VA right when they get out.
Okay, so let me just, for people who are at home, because it may not have been picked up by the microphone, that when you get out of service as a veteran, the first thing you should do is, or one of the first things you should do is go to the hospital or the VA and check on your benefits.
The first thing you need to do is do an application, which is a 10-10EZ.
10-10EZ.
You need to do that the first thing when you first get out of the military. I don't care if you get out tomorrow or the next day, do it. The retiree, a lot of older veterans I met since I've been around, it's like a few years. And everybody thinks I'm retiring in 20 years, so I've been here too long. A lot of them got a bad taste in their mouth. And they told them, I don't want to go back to the VA. The VA has changed in the last 20-some years since I've been there. We have made it easy for you to get in, give you the information. If you don't think I've done this personally myself to make sure veterans got the information. Because the more information you got, the more power you have. We're not smart, we're not bright at times, but we do know what we're doing. The thing about you need to do It's when we come and ask you these questions, well, I don't want to answer all this stuff about my money and all this stuff. We need this information so we can do an accurate information for you. I like accuracy. I will not talk to you unless I can read your paperwork or look at you in the computer. Because if I do that, I've done a great service to you. If I tell you to go file a disability claim, I'm not doing this for my health, because I got my disability, you ain't got yours. And you need to go over there and get it. The only one thing the lady did say wrong, I'm not saying wrong, but she didn't say one thing, is guards people. I am very, very sorry for guards people. If you did not deploy, you cannot get VA health care right now. You have to file a disability claim. And the biggest thing any veteran can file a disability claim, can anybody tell me what it is? Thank you. Because the government at one time, I used to say another word, didn't give good hearing protection. So you as veterans, don't sit down and, a lot of veterans complain about the VA, but they have walked in the Spokane VA in the last 20 years. I know we give good service at our Spokane VA. We give the best service we can with the money we got. Sometimes we can't do certain things, but we do our best. So don't talk about us unless you came and seen us. We got, from the director, social director, the patient advocate, we got a lot of people will be working out, you know what, I can't say other words, but working our tails off to make sure you get your health care. Sometimes I can't do it, but then I'll come back and find another way to help you out. I've called the service officers and begged them to help me out sometimes. They beg me. We work as a unit. But you, as veterans, should get off. You know what? Stop talking about better. Come over to the VA and register. I got applications out there right now. And I bet you some of these veterans, some of you people in there are getting disability money are not registered at the VA. So you need to register to get your disability going. Just like they said, the more you do, the more money we get, the more we can help.
All right, what's your name?
I don't know.
What's that?
I don't want nobody to find me.
Well, no, I need to know, because we might want to bring you back up here to answer some other questions.
He's the mayor of the VA, sir.
Okay, the mayor of the VA. All right, we got
Trey.
that.
Okay, this is the only reason I got told this title. About so many years ago, there's an article written about me by a reporter over here. And so it went sort of like viral, yes, because everybody in the VA knows that I will kick a lot of doors down. I've been threatened to be fired about 25 times because I will kick a door down to help you out. And everybody know I will walk down to the director's office. I'll walk to a social worker's office. I'll walk anywhere I got to and take you with me. Say, hey, why we can't get this guy taken care of? I just did that the other day. I just saved a guy's life. His wife did not know what to do. I did something, helped him out. She's happy, she was crying. I said, why are you crying, man? We do our job here. She cried. We help our veterans here in the area. I have never not helped a veteran. I will always help a veteran. I'm for the veterans. So you need to get off, you know what? Come register. Don't talk bad about us. Come see us. If you want a tour, we'll give you a tour.
Well, thank you, Mr. Mayor, and forgive me for not acknowledging your elected status here. So, very good. All right, this question is, if my wife passes before I do, can she be buried in a state or national cemetery?
Yes, she can.
Okay.
So it can get complicated for different cemeteries, but I'll speak to Boise and Blackfoot. So if it's a casket burial, we have a double interment site, which means one casket goes on the bottom and one goes on top forever. So that's up to the individual dynamics of your relationship, how that works out. But yeah, some cemeteries, like I was just speaking to the director in Montana, and due to the weather, they do single, so it's side by side. But it doesn't matter who gets interred first; they're both eligible.
That's good to know. And are there any exceptions, anything that a spouse should be aware of?
No, I mean, it's always great to pre-register. The national calls it a little different, but for the state, we have pre-registration. That's to get the 214 and the marriage certificate on hand, so when the time comes, it's an emotional time. You don't want to be digging for that information, especially if it's a World War II, Korea, Vietnam, trying to find that 214 beacon. Really hard to find, and during that time, that's the last time you want to be digging through files. So pre-register, and then what that does is, so when that time comes, you work with that funeral home, let them know that you've already worked with the cemetery, and we've already got all that paperwork squared away. So it makes that process a lot smoother. For the state, the big difference with the state and national, and I don't know, Rudy's here from Washington State. In the state of Idaho, right now, the spouses have to pay $978. It's not covered through the VA or VBA, or National Cemetery Administration. We're working on getting that changed, because at the national cemeteries, there is no cost for the spousal interment. However, in the state of Idaho, it's the current rate that the VA charges, it's $978, so there is a spousal interment fee. But there is some paperwork in DC that they're trying to get that approved. We're just waiting on that, so.
And it sounds like the earlier you start, the better it typically works out.
Correct, yeah. Anytime you can pre-register, and you can't prepay, we get that question quite a bit, like lock in a rate at $978 and pass away, 20 years later. No, it goes up every year, every fiscal year that the VA sets. So this fiscal year, it's $978. Next year, it'll be probably closer to $1,000.
All right, thank you, Jake.
Yep, thank you.
Mitzi?
Couple questions, hold on.
Go ahead.
Yes, sir, Rudy.
Why don't you come up to the microphone, because that way people who are watching at home, they can, and just state your name too.
Rudy Lopez, and I'm with the Washington Department of Veterans Affairs, so I manage the cemetery in Medical Lake. One thing to add to the question that was posed, what do families need to know? What does the widow or widower need to know? They need to anticipate there's going to be some costs. Cemetery, no charges for burying veterans. But funeral-related expenses, there are expenses that you have to pay for up front, and a lot of families feel the VA is going to pay for everything, and that is not true. There are ways to assist you with some of those expenses if you're service-connected. So it goes back to previous conversation.
Thanks, Rudy.
Thank you.
There was another question. Nope, gone away. All right.
Mitzi, did you want to add to that?
I was just going to ask Jake a question because I encounter it out in the community a lot. What if both the husband and the wife are veterans?
Thank you, Mitzi. So, again, up to the dynamics of that relationship, but both are veterans, both are entitled to their own plot, so you can do side by side, and typically that does happen, more frequent than others, but you can be in the same plot. However, you'll have to decide who goes on the front of the upright headstone and who goes on the back. Again, individual preferences. And then if it's a niche cover like a columbarium wall or a memorial marker, both information will be on there. It just gets really tight when you start putting the military information, the dates of service and dates of death. Doesn't leave a whole lot of room for personalization. Typically you get like one line, like together again or together forever, but when you have those individual plots, you can customize the last couple words you want to put on there.
Great, thank you. This question, I think, would be more for you, Amber. What are the qualifications to live in the Post Falls Veterans Home?
So you have to have a doctor's order to live there. It is a skilled nursing home, and you have to be honorably discharged, and there is no income requirements. And that's about it. Their spouses can live there. You have to have been married. You couldn't have been divorced, but you could be a widow or widower. And then your question, sir? No, you don't have to be disabled. You have to have what's called doctor's orders. You have to need help with your ADLs, so activities of daily living, whether it's medicine management, bathing, toileting, those types of things. But there's no requirements for being disabled.
But
What are you
your
talking about?
disability rating can affect how much it costs for your care at the Veterans Home.
Now, just out of curiosity, is that the same standard, doctor's orders, for the other veterans' homes throughout the state?
Yes, because it is a skilled nursing home. Even though it's called a veterans home, it is still a nursing home.
Would that also apply in other states?
Yes. For all of there's 177 veterans homes across the states. So we're very fortunate that there's that many to serve veterans throughout our nation. And we all have the same rules and regulations that are, because we're all VA funded. And so we all have to follow those rules.
But not all of the veterans' homes are like the Post Falls one. Is that kind of a new platform for what they're trying to do in the future, or because that is an amazing facility?
Yes, we're the Mercedes-Benz of veterans homes. So yeah, the concept is to move to private baths, private bedrooms, because you guys deserve to have your own bedroom and your own bathroom when you get to that age, right? And not have to share. And so the concept is to move that direction. It's called small neighborhood concept.
Okay. If you have a question, you can come up to the microphone, or President Swain will bring it over to you, or you can go over to him.
Does the veterans home accommodate dementia patients?
We do have dementia residents. We do not have a secured care unit. Our facility down in Boise has a specific unit for Alzheimer's, but we do, I would say 90% of our residents have some form of dementia diagnosis. So we do provide that service. If you're wandering and need a locked unit, we don't have that though.
At this time at Post Falls,
Correct.
you don't have that?
Mm-hmm.
Okay, perfect, thank you.
If I could add one thing to that, the Boise home is being replaced. Because I personally know the administrator down there.
Yes.
Rick Holloway is working to get a new home down there, and they're working on the budget and getting it built. And I think it's going to be a Mercedes-like up
It
here.
is. All of the veterans' homes that are being planned to be replaced in the state of Idaho will be following the same concept.
Yeah, well, that's very good. Thank you. So the Spokane VA Medical Center seems to have a large staff turnover. This is another question from the stand down. I'm always being assigned a new doctor because my physician has left. Is there any merit to that? Is there something happening? Sarah?
That does happen from time to time, and generally, folks express concern about that when it happens within their primary care team, and making sure that we've got, you want to have that long-term established relationship with your provider. If you've gone through your litany of medications and conditions and you've developed that sense of trust. So we do a lot of work within primary care and across our teams to make sure that we're understanding what it is that prompts people to leave if they do, and addressing those concerns. Maintaining some dialogue there has been helpful in just seeing what we can do to best support our teams. Sometimes there's workflows that are really onerous for people, or there's a volume or an approach that we use to something that can really cause some backup for folks that are trying to make sure that your entire continuum of care is functioning the way that it should. It's a tough job. We try and maintain really full panels at about 1,500 veterans, depending on the circumstance. So they're responsible for a lot of individuals, and those relationships mean a lot to the providers too. Generally, when we step in as leadership, it's to make sure that we're doing everything that we can to provide a supportive environment to the individuals that are working directly with veterans. But it can get complicated at times, and it can be a number of different things, whether it be shifts in focus because of like the pandemic was very disruptive for how we delivered that care, pivoting to telehealth in certain circumstances, or using that temporary coverage from folks that can step in. It gets very complicated, but that is a real primary concern for us because it can be any number of things that make that really difficult at times.
Mm-hmm. Okay. Do you experience the same challenges trying to hire and find qualified doctors and staff?
It really depends. I would say from an individual that goes to new employee orientation quite a bit, generally the reason people come is because they've heard from other people that work there or have had a family member cared for there, and there's something really appealing about the mission that resonates with people. Mm-hmm. So the people that that come to work for the VA Medical Center have a lot of grit and a lot of resilience and a lot of care and concern. And that's what draws them here. So word of mouth is honestly the way that we get a lot of new employees.
Do you find that it's easier up here than in other parts of the country just because of the location?
Well, there's a lot of appealing aspects for
Yeah.
sure. Yeah, it really just depends on circumstances, even beyond our control. What is
Yeah.
the rest of the market doing? What does healthcare look like in the community? Just any number of factors. But I would say the folks that we're privileged to work alongside care a great deal about making sure that you get your needs met. And there's a lot of different processes and things that can get in our way sometimes that we have some level of control over. But they want to maintain those long-term relationships just as much. So I appreciate that it was brought up. It is a really important thing to pay attention to.
Yeah, well, thank you. We're going to shift over to Bonner County a little bit. This is another question that was asked last weekend. Can you give us any update on the status of the Sandpoint Bonner County Outpatient Clinic? Will the old contractor have a chance to come back? I don't know if anyone up here has any relationship or nexus to Bonner County.
Bonner County is a contracted rural health clinic that is overseen by the Man Grandstaff VA Medical Center. For a number of years, it was overseen by Kinixu. They had a really established relationship with veterans in the area. The last time I recall doing some outreach events there, it was evident that people had a real investment in that clinic there. They were familiar with the staff. At the time that it was up for renewal, it was awarded to a different contractor that applied for that. They built the new facility, and they offer primary care services there. But I'm interested to know, based on experience tonight, and anybody that wants to reach out or share information with our teams, if there's opportunity to help promote what's available there and see what gaps there may be. Brett and I had the opportunity a couple months ago to go speak with folks in Priest River because we had heard some things as well. And I think some of it is just establishing an awareness of what's available there because it is a primary care clinic. And so there's a lot of things that turn into getting directed to the community for a different level of care or different type of service. And I'm not sure how much that resembles what was in place previously.
Great, thank you. Do you have a question? You can come right up to the microphone. Or actually, we can bring a microphone to you.
The PACT Act really saved us up in Bonner County, but were you ever able to fully staff that contract clinic? Fully staff it?
Maybe we can chat after this because they have availability with the providers that they have, and the feedback that we get is that they've got opportunity to meet the established provisions within that contract. So if you're seeing something that's not what you expect or is contrary to that, let us know so that we can work with them, because I think sometimes it's just getting on the same pages. What's impacting that or what's driving that feedback? I think for a period of time they were down a primary care provider and had some coverage going on there. But I know that they work really hard to be competitive in that area and attract folks to that clinic. It's beautiful. They have a lot of capability to do great things there. So we continue to work with them. And we've got some really great folks in the medical center that are focused on rural healthcare and specifically working with those contractors both there and in Libby. So if there's opportunity to do something a little bit differently, we're totally open to that so we can follow up.
Great. Now, this is an interesting question. Can a spouse file for benefits on a veteran's behalf after the veteran has passed?
Take that one.
Sure. Thank you. Scott?
The best answer is it depends.
Okay. Well, let's give us a
Right,
couple
so-
big scenarios of the it depends.
The benefits are, while the veteran is with us, the benefits are primarily for the veteran. If the veteran passes, the benefits can stop because of benefits for the veteran. If the veteran passed away due to a service-connected disability or one that should have been a service-connected, the spouse can obtain benefits. So can file a claim post veteran passing, right? But if a veteran is passed and the spouse wants to file for a right knee, the veteran's not with us. They cannot evaluate that right knee. So there can no longer be claims filed. It has to be due to death style claims
Sure.
to be able to be filed.
So it goes back to start early, register, get your benefits eligibility established.
Absolutely. And to caveat on what Mr. Chample said and what Trey said, one of my mantras is ask the question, because the answer is always no if you don't ask. Even if you think or your battle buddy or your neighbor said you're not eligible, they don't make the rules. And by the way, rules change. Just like the PACT Act, a lot of you got greatly affected by the PACT Act. But if you would have went by the old mantra of, well, I was denied the first time, I'm never going to file, well, guess what? You're now eligible. So ask the question, even though you've been told no. 90% of the time, and I come up with that number on my own, but 90% of the time when the VA says no, that's not permanent. That's no for today, because if rules change or your situation changes, you can then become eligible down the road. So ask the question and keep your ear low to the ground on any VA changes or things like that. So, but please ask the question.
And the veteran does not have to be 100% rated for the spouse to get benefits, is that correct?
No, for the spouse to get what's called dependency indemnity compensation, so we like to use acronyms too, DIC, two conditions have to be met. It's an or. The veteran has to pass away due to a service-connected condition or one that should have been, and I could explain that in detail if need be, or the veteran was 100% service-connected for 10 years or more preceding death. Could have been 100% for hearing loss. Nobody's going to pass away due to hearing loss, right? But if they were, I know, got hit by a train, but they could look too, right? But because they were 100% for hearing loss for 12 years, the spouse can get that DIC benefit. And the current rate right now is around $1,700 a month, tax-free for the rest of their life. And that goes up every year with a COLA increase, so it's worth it.
It's significant. So, thank you. Folks, if you do have questions, you can, of course, ask at the microphone or fill out a card and submit it. Can you explain the Compact Act? Why are veterans being told about the Compact Act, but healthcare and ER staff don't seem to have any idea what it is? How can vets be cared for? Anyone want to take that on, the Compact Act?
Do we have,
I'm unfamiliar
Where's
with
the
a
mayor at?
do we
compact.
have somebody on the benefits side of, yeah.
Hey,
Microphone.
Good evening. My name is Brett Bowers. I'm proud to join the team from the VA Medical Center. The Compact Act is for veterans in mental health crisis. And if they are in crisis, they can go to any hospital or urgent care center or local emergency room, anywhere, and report in that they're in crisis and get cared for. They should, whoever brought them there, or if the veteran is capable, to let the staff there know that they're a veteran. And then from there, they can get inpatient care for a period of time based on the referral. And the clinic there that treats the veteran on that initial contact will notify the VA and pick it up from there to allow the continuum of care to proceed properly. It also allows for extended care, and we have an inpatient care unit for mental health needs at the Spokane VA Medical Center. But the Compact Act also applies for hospitals and inpatient care at other institutions in the community.
now, have these hospitals been notified about this act? Because I think
Thank you. It's
that's the challenge, is that you show up and you say, look, I should be covered by this act.
So this is a nationwide new law that went into effect a couple years ago, and certainly the larger healthcare systems in the country are aware of it. We've done some outreach with emergency rooms and local in-network organizations that are connected with the VA already. We could certainly do a lot more to get the word out, and that's why these meetings are so important, and people like Hank and others who build that kind of continuity of care to get mental health in the rural areas where we're not there yet. But the Compact Act can certainly help those, like the next gentleman who's going to speak, and any other organization in your community. Thank you.
Thank you, Brett.
I think, Bruce, maybe what, if there, I got, I'm a veteran, when I processed, I got a list of all of the contact information from grant staff. If you could maybe, if you go to a place that doesn't know about it, you can always call the VA hospital, and the VA hospital will answer those questions for the hospital that you're at. I'm sure that we've had employees here that have had those problems, and sometimes we have to walk the provider through that process, and really all we have to do is connect them to the VA hospital, and they'll take care of it.
That's good to know.
I'd say
Thank you.
that's probably the best thing to do is call the VA hospital.
Thank you. Sir, do you have
My
a
name is
question?
Hank Thornton. I run the Veterans Outreach Center in St. Mary's. Our goal is to stop suicides, and we've been very successful at it. In the last 12 months after the PACT Act, I've had 7 veterans who, due to joining forces, which is part of the VA program with the Governor's Challenge that we belong to, our communities come together and the doctors call us, and the doctors tell us, we have a critical patient who wants to commit suicide. They're in my office now. They've given me permission to talk to you. Can you come get them and help them with mental health? So we go pick them up. 7 in the last year. There's nowhere to take them. What he says is not accurate. There is nowhere to take them. The hospital in St. Mary's, like so many little hospitals and little communities, have no mental health programs. So they just check their vitals, and they physically walk them out the door. I have been there with them, and they put them in the parking lot. So we put them in our car. We counsel them as best we can. We spend hours with them, sometimes all night with them. Now, a lot of these veterans are veterans I've never met before. So I can't put them in my car and drive an hour and a half to the Spokane VA. It's dangerous. I don't know what they're going to do. We had one of them jump out of a car at 40 miles an hour and try to kill himself. I can't take that responsibility because it's dangerous to me, it's dangerous to them, so we have nowhere to take them. But the Compact Act told us 2 years ago at our conference in Boise that you can take them to any mental health facility in your hometown, and that mental health facility can treat them, and the VA will pay for it with no paperwork. That is not accurate, and they just told us that again 4 weeks ago in Boise. They're patting themselves on the back with the PACT Act, but the Compact Act doesn't work in small rural towns, and there's no help for mental health. And you wait till one of them kills themselves, and then you're going to have to answer for it.
Well, Mr. Thornton, you bring up an interesting point, and so I'd like to ask the panel, you know, obviously in the more rural areas, the resources aren't there as much as in the more populated areas. So what kinds of things do we think can be done in these rural areas to address some of these issues? Does anyone want to take a stab at that?
I know when I was in law enforcement, we used to do a lot of 72-hour holds. Is there nothing like that in St. Mary's?
No.
Nothing?
No, we've got the hospital, they have built a safe room to where we can take a suicidal patient for overnight for a few hours or whatever it takes. But we find at the same time they don't have staffing, and some staffing has to sit there and look through the window so they can see them. And we've offered to sit there with them, but they won't let us do it because of liability situations. But there's nowhere to take them, and it's, you know, I don't know what to do. I've got a veteran on my hands who wants to die.
Yeah, of course. What about an ambulance ride to?
Ambulance will take them, but the VA has to give authorization. It takes 3 weeks. So by then, we've lost the veteran.
Even if it's a critical situation?
Even
like
if it's a critical situation.
All right, Mr. Mayor, did you want to
Yeah, can I ask you a question? Did you call an 844 number?
No.
844 number is a VA authorization line. If you call that number, they will give you an authorization that tells the hospital. That's the whole thing. It's a little line that, I got one of my cards. I ain't got on my, you got on yours? Emergency care, call them. They'll
Okay.
give you an authorization number. That's been out for a long period of time. Maybe in the small towns, y'all didn't know about that number.
No, we didn't.
Okay. You always call that number. The VA will give an authorization number, and they will go over there and be writing the stuff out there, and then guess what happened? It gets notified to the hospital next morning. The nurses will get it. Then they'll say he's not in the system. They'll call us. Then we'll do all our diligence to make sure we get all the stuff taken care of to get him in, taken care of.
Okay, now does it work in mental facilities too?
It will work-
Heritage Health, Panhandle Health, or any of them? Because the hospital's not gonna do it.
You have, whoever has to call that number,
Okay.
right there, call that number, and the vet, you tell them you call it for veterans so-and-so, 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 and you give their information, they will give, they said, this is the authorization number, and then they will send the thing the next day to the VA hospital, which is a set of nurses that get it the next day, and then they'll say, the guy's not in our system, and then they'll call me or our staff, and then we go do our diligence to find everything we can about to get the stuff going for the veteran, and then after we get it going for the veteran, then we try to get them to come down here to go to our third floor, whatever it is called. They had room for me up there one day. But that's where they will go.
Okay,
That is that number right there.
we'll try it.
Okay.
We got, at least it's a start.
Well, I just call it 844 number. It's 844-724-7842. And that's been out for over 5 years or more.
Okay.
Also, Mr. Thornton, if you're open to it, maybe we could chat about some of your experiences after this too,
Sure.
because it sounds like we need to have some reassurance that with our community partners, things function as they're designed to.
Yeah, the VA, just like he said, a lot of people don't like the VA. And we've worked hard to change that concept because the people at the VA are amazing. They really are. The system sometimes screws up or doesn't work or doesn't flow well, and that's what a lot of the old Vietnam vets are feeling. And when we tell them we want to set you up with a VA program, they just, no way. And we let them know that we can get them on community care so that they can go to a local doctor and so forth. And that seems to work, and it flows well. But when you got one that's suicidal, and he's in your car, and you don't know what to do with him, and you talk to him and talk to him and talk to him, so far we've been lucky. But we're too hard to lose them, and you can't lose them. So,
I appreciate what you're doing. I'd love to connect with you afterwards.
okay, thank you.
Yeah.
Thanks, Dan.
And I would also have to wonder too, if the counties, the government can't find some way in partnership for the transportation to get people help, because in some of these rural communities, the resources are just not there to provide the help. And so maybe if there was a way where, we could get a county vehicle to do the transportation in a safe way, I don't know, or something where the VA could reimburse and it wouldn't end up drawing too much resources. I just wonder if that's not something that could be explored, and if there's other ideas that anyone has. I know as a county commissioner, I would certainly try to figure out a way to make something work, as long as it didn't affect the liability and didn't, create a potential safety issue within the community because it was drawing too much resources.
One of the things she made me think about is going for emergency room care. I mean, not emergency room, ambulance care. I can't say the word ambulance, I come from the South. So for ambulance care, it's very difficult in one way, because when a veteran, I have issues with ambulance a little bit, y'all. So I'm trying to talk correctly, not say what I really want to say. But with ambulance, when a veteran goes to get an ambulance, they charge the veteran at first, but they have to, when you get an ambulance ride, to just say to whatever. You have to, after you get that, you got to call the VA back and tell them you want an ambulance ride. Because I'm trying to say it not, because anybody works for the ambulance company in here? I don't want to say it. Okay, ambulance people are money grabbers. So they turn around and wait. The VA has just say if you go in the hospital and we take care of you. We pay the whole bill. The ambulance company the VA has a certain time period of getting a bill taken care of. If it's not taken with that time period of bill, you say, oh, that ambulance has been paid by the VA, everything's been taken care of. What happens is they wait past the VA's time period, send the bill in, the bill is closed. Once that bill closed, these people can't open it back up. Sometime they can, and sometime they can't. So we get caught in the middle of an issue where you got a $2,000 ambulance bill, we paid your $300,000 hospital bill, and we can't pay the $2,000, and then you mad at us. So that's why we tell every veteran, if you go to the hospital, have somebody call the VA hospital the next day and say, hey, I was caught with an ambulance ride, and they can look it up to see, make sure they got that bill. The thing about you as veterans, you know what y'all do? Y'all won't think we're supposed to do everything. Get involved. Don't let us do everything. Get involved in everything.
Trey, I've got a question right quick. This 844 number you gave, would that be a number they would call to authorize the ambulance?
No, they would have to call the VA hospital, 509-434-7.
7540.
So each hospital's going to have.
7026.
I'm trying to think of the travel office. I got it on my piece of paper out there, but I'll give it to y'all before I leave. But I have it on a piece of paper to tell you what the travel office number is, to call them and to let them know.
So Trey, in the case of St. Mary's, if they have that veteran who goes to the hospital and they need to send him by ambulance to Spokane that night, the next day they can call and get that retro authorization?
Yes, they can. 90%, about 75% they can, they will do it. Depends on what the issue is and everything else.
I would add too, that's really complicated depending on the circumstance. There's a number of factors that go into that. Because the rules around travel are different depending on how you end up being engaged with it. Is it emergent transport from something that happened? And it's really complex, even to people that have worked at the VA Medical Center for a really long time. I do think it's something that we could follow up on and make sure that there's a resource available. If you are experiencing an emergency, there's not a number that's going to authorize the ambulance at the time of that. Please do what you need to do to get emergent services. When you become aware of being transported by ambulance, call a member of our team, call the 844 number. There are a number of things that factor into how those things are done and considered for payment that are somewhat time sensitive and need that notification piece of it. When in doubt, reach out, and if you receive some sort of correspondence from them, we have a number of teams at the hospital that can help look at that. It's complicated even for folks that have dealt with it before.
The travel number is 509-434-7517.
7517.
Thank you, because I forget.
Thank you. Thank you. Did you have a question you wanted to ask? Go ahead.
Well, I do have a question, and it's actually, there's a couple of them within this. So when you talk about the medical center over in Spokane, some of you call it a hospital and some of you call it a medical center. I was not aware that it went back to a medical center from an urgent care due to staffing issues. Can you clarify that?
The same services are still available there. It's just a difference
Not
in
24
terminology.
hours a day.
No, we still have 12-hour urgent care every day a week. It's been
And
that
it's
way for a while.
not accepting ambulances at any point in time at Spokane.
Right. The designation of urgent care clinic limits us in that respect, so there aren't transfers by ambulance to that location, so we rely on partners when we have to navigate certain things.
Okay, so it's not a hospital, it's a urgent care facility,
Well,
With
correct?
a number of other services, and we don't have an ER, if that's the question.
Right, but there's limited spacing for overnight people at that facility now, correct?
we still have an inpatient unit for a number of different things. I'm trying to,
But if somebody goes in and has surgery done that they require a 24-hour stay after surgery, they're not able to stay at Spokane. That's why it gets outsourced to another care of the community facility, correct?
it really depends because sometimes folks transfer back when it's not an emergent circumstance. So if
Okay.
there's a specific scenario or if there was a procedure that happened at another community hospital where the patient's stable and there's a coordination there, that can be transferred back to the medical center. Isaiah, you look like you have something to add.
Sorry, I work over in the community care department. Yeah, now that everybody sees me, I'm gonna get a ton of questions. But with that, we do have a team. I have some admin team in my department, and we also work with some of the nurses that Trey was talking about earlier. And they're constantly checking ERs and inpatient units out in the community to see if veterans can come if we have room. I don't know what our bed count is. I don't necessarily work in that, but we do have beds that we do actively try to bring veterans to stay at, until they can be discharged. But yes, so it is a hospital. I've gotten a veteran myself. I've gotten all my surgeries there. And unfortunately, one time I had to stay the night, but they do have beds. I can speak to that from personal experience, so it is complicated, but we do accept transfers. And if we don't, we can also, that same team can also work with you to go to Boise, Puget Sound, or Seattle if they have open beds too, if they have those facilities.
I think there's.
Why are you gonna transport a patient from Coeur d'Alene, Spokane, 300 miles away from their home for a simple overnight stay due to a surgery? That doesn't make sense. That doesn't make cost-effective sense.
I'm not saying we would, I'm just saying that option is available to veterans.
Okay.
Can I add-
If they want to come to a VA facility, there are options open to that.
Okay.
Yeah, kind of to piggyback on that, if there's things that are beyond the scope of care that we're able to provide for whatever reason, we partner with folks around us, whether it be another VA medical center or a community partner, to make sure that we're getting things taken care of on time. If it's something that can't be accommodated immediately at the medical center, then we track those cases so that we can work to get folks back.
Perfect. That answers the question. Now, the next question is, I see the statements that come in from TRICARE or Triwest for this area. For my care in the community, it says the amount that was billed by the provider for care in the community, and then there's a much less amount that's paid by VA. So why is there such a drastic difference? If there's a $30,000 surgery procedure that was done and VA pays $6,000, why is there such a drastic discount to that provider? Did he not do the same job that he would charge anybody else the $30,000 for? I'm missing the explanation of that pay gap, because they still have medical bills that they've got to pay. They have their schooling that they need to pay for. Just because they're not at a VA facility, I'm assuming that at a VA facility, it would still be that $30,000 charge for that procedure. Is the VA only paying $8,000 at its own facility, or is it paying the $30,000 at its own facility, but it's giving the care in the community doctor only an $8,000 paycheck, along with the facility that the surgery was done in?
So a lot of time there's overlap in the rates that are reimbursed to providers based on Medicare rates or some calculation of that. I'm not sure if somebody on our team would be best positioned to speak to that.
But you said Medicare. I'm not Medicare.
Right. In some cases, what VA reimburses to other providers matches that of Medicare or some percentage of that. But it depends on a number of different circumstances.
Typically with the medical field. If the VA sends you to community care, there's an agreement between the community care entity and the VA, and typically those agreements have established maximum allowable charges for the services provided. So that's why you'll see a difference. Community care may normally charge X amount for somebody who comes in with no insurance whatsoever, but typically the amount that's actually billed and paid is a negotiated rate that's typically the maximum allowable billable rate between the VA and that community care entry.
Okay, so why isn't that on the statement from Triwest or TRICARE? That should be on the statement, not making me feel guilty saying, geez, I had a $30,000 procedure done and the VA only paid $8,000. Makes me feel guilty that the hospital, the doctor, the pharmacy, the anesthesiologist, somebody didn't get paid.
Oh, they're all getting paid. Again,
Well,
that's just the negotiated rate, yeah.
I understand that, but why doesn't it state that on the statement from Triwest, TRICARE? Why doesn't it state that in the statement? Hey, the negotiated build rate was this, we paid this.
The reason I know this is because usually it's in the very fine print. It's
No.
usually stated in other places. So again, I mean, the bottom line is they're getting paid what they should get paid.
Okay.
You shouldn't feel guilty about it.
Okay.
It's a negotiated rate. It's part of them being a community provider with an agreement with the VA.
Okay.
And again, the lawyers are involved and there's negotiations and stuff like that, so.
I understand that, but I can pull it up on my phone and show you some of the
No,
statements
I
where it
agree with you,
says-
but like you want them to give you like a 10-page explanation of the
No,
negotiation that they went
But
through?
why is the build rate
Well,
still on there? It shouldn't be. It should just be, hey, we paid this amount of money for your procedure.
is there a place that that this gentleman could call to get more in-depth? Because every bill is different. And to be
Triwest
able to
could
try to-
probably give you a lot more
Triwest.
information.
Yeah,
Yeah.
thank you.
Yeah,
So-
there's a lot that goes into it. And again, I'm not the expert on it. This is how I know about the agreements that happen between medical providers and what actually is billed versus what's paid. And I'll be honest with you, the billed amount is usually grossly over exaggerated.
But isn't that what the VA collects from the taxpayers?
No. The VA doesn't collect anything from taxpayers. They get a budget. They get a budget, yeah, they get a budget, but it's not, the VA doesn't collect $30,000 for a surgery and that's how it works. They're just given a budget.
So the taxpayers are getting a prorated amount. Taxpayers are paying a prorated amount for that surgery. Is that what you just said?
No.
No.
You pay your taxes. They go to the federal government. The federal government then gives the VA a budget.
But when the VA does their budget, okay, they've got a medical budget, they've got an infrastructure budget. How do they do their medical budget? How do they figure out, okay, we're gonna do heart surgeries, or not, because they go around here. What's the budget for Spokane? What is the actual?
So I think what you're thinking about is how do they know how much of these procedures they're going to do in a given year, right? Well, what they're doing is they're spending money for the overhead, for the specialist, and then they're available to provide these procedures. So you're spending money for salaries, you're spending money for the overhead, and then they're available to provide these procedures. Where when you show up to a hospital, they're going to charge you for that because they're not funded the same way as the VA. And so I think that's really where the disconnect might be in your question.
Well, and I don't work for the VA, but I work with the VA. And again, I work with the VA at a high level. So again, I have on the outside knowledge of how these things are done. So how does the Spokane Medical Center budget for the services they're going to provide for the next year? So again, they keep track of everything they spend on an annual basis, and they forecast, hey, this is how many veterans we have, this is how many veterans we have enrolled, this is how much we've spent in the years past, this is how much we anticipate it's going to increase the next year due to X, Y, or Z. PACT Act has increased a lot of medical care, so they had to try and adjust for that. A lot of it's guessing. I mean, again, you're establishing a budget, it's based on past numbers and other things like that. So they do have some data that they go off of to establish their budgets specifically within the different categories that they're going to end up spending money. You know, we start off by saying, hey, in this specific county, this is how much the VA spends in dollars. So they track it. They know how much money they actually spend. And again, they use that data to help drive those budgets. Again, there's a little bit of forecasting involved, but again, there's a lot of data that's also put into that.
So we have a couple of questions from the audience tonight that's related to hearing. There's not a lot of vets with hearing loss. Are there any local support groups here for folks with hearing loss? And is there anything that can be done when making phone calls, especially to the VA? Would anyone like to talk about that? I know that obviously the VA covers hearing loss, but are there any groups? Are there any? These are the questions that were submitted. Anyone that works with vets with hearing loss?
I'll touch on it. My answer for hearing loss, I don't know of any specific groups to be, for lack of a better term, a hearing loss club, you know, to help get along and learn how to deal with hearing loss. The VA does have a vision section where they deal, you know, training for the blind, you know, and such, but hearing loss specifically, no. But you are right, the VA will treat every veteran who's enrolled in VA healthcare for their hearing loss, whether they're service-connected or not.
Now, I think a lot of the hearing aids today actually connect to your phone so that you can actually hear better on the phone call. But I'm not sure, is there something that needs to happen on the other side of that phone call to help that vet when it comes to hearing? Not necessarily.
Speaking of phone call, there are a couple companies out there that have, you've probably heard of caption call, the types of phones where it'll read out, it'll text out what that person. Do you know those are free? You do have to ask. Remember, ask the question. Those are free, and they're not low-end things. Our service offices have contact information for that. I believe the county office even has a floor model to show you what it looks like. But there are a couple different companies out there, Caption Call and, I can't read it.
Spokane VA Audiology Department.
Correct, that's who treats your hearing loss.
Yeah,
Right,
have people call there, and they'll take care of it.
right, absolutely. So, but there, again, there are a couple companies out there that will actually provide you, come and set up in your home these phones, and it's free. And you do not need to be service connected. Just gotta show, yes.
Thank you. Now, did you have a question?
I'd like to add a little bit to that question.
Okay.
I don't know if I need a mic.
Well, it would help just for the folks. I don't know. Can we get a microphone over here for this gentleman?
For those vets that do have hearing loss, as you age, it seems to become more and more difficult to get out into the public and understand what is being spoken by the people around you. And I belong to a group called the Hearing Loss Association of America that about 5 years ago started a veterans chapter within that group. They have a monthly Zoom meeting open to any veterans with hearing difficulties. And they discuss the topics of what do I do when I go to a restaurant and I can't hear the person sitting across the table from me. In an environment like this where you've got a speaker and the sound system is excellent, there's little or no difficulty. But I can go into some meetings and I can hear maybe 10% of what's being said when I'm in that meeting. That causes more and more isolation for vets as they get older. They're saying, hey, why should I go? I can't hear anything. But I think we need a support group locally
where people like myself that have that same difficulty can get together. I've got a device that I got from the VA, from the audiology department in Spokane. I read the instructions, but I'm still not sure how it works in an open environment that has a poor sound system. So I just add that comment. Thanks.
I would offer too that I think that we can bring some resources back from our audiology department too. If there's a feedback loop we can close with folks, we'd be happy to look into that.
Yeah, I think that's a big issue, is getting good feedback. So even some of these questions tonight, I think, are feedback questions that kind of say, okay, why are people asking these questions? Where is the disconnect here? So, yes, sir.
I've been to different areas, and I have been offered at a couple of different VA hospitals the option to actually join a group of audiologists, and also part of it was mental health, where they were both working together, because I don't know if any of you have experienced the challenge with this continuous tinnitus, severe tinnitus, and sometimes it can really affect a veteran's emotional well-being. I've never taken advantage of the offer, but I can see where it could be really good for some veterans. I do know oftentimes at night, it can be difficult to fall asleep. And then if I wake up during the night, when you've got that continuous ringing, it's nonstop, I can see where it can be very demanding and a big challenge for a lot of the veterans. And so I know that some of the VA hospitals, they do offer counseling and help in that area if there's sometimes depression and anxiety associated with it. Yeah.
Thank you. Anyone like to comment on that, or no? So, I have some other questions here. I'm going to go ahead and ask. And again, this is from last week in the stand down. Why does it take months to be seen by a specialty doctor? Example, dermatology, mental health. Now, I realize everyone's situation is different, but this is a question that I guess this is what they've experienced. Would there be a reason for why it would take a long time to see a specialist?
I think that's one of the areas that we work on trying to improve across the board, because it depends on circumstances. If it's something that we're able to offer internally, it has a life cycle that goes this way, and if it's something that goes into the community, it has some other steps in the process. But I think that at times the expectations of when that care will be coordinated, when you'll get contact, who is going to contact you, where you're going to be seen, are not clear for a really long time. And that leads to a lot of questions about when is this going to actually happen. And when you have, when you know that you have a referral that's been placed by somebody and you can't get an answer on where it's at, that becomes really problematic, because everybody wants to help, and it takes a lot of people sometimes to figure out where exactly it is in the pipeline. I'll say that this has been a challenge for us. We have a lot of different processes that happen, and it's really not meeting the needs in all cases, in many cases. So it's the focus of a group that got together just today to see how we could take a step back from that and learn from what veterans are experiencing to take away some of that unnecessary challenge. There's got to be a way to streamline some of these things that are impacting a lot of people, whether it's applying a different strategy of how we triage these things. The bottom line is it doesn't seem to be working across the board for people that need that care. And we've got a number of talented people that can work on that. So if you have a specific question, our team would be happy to take those after that so we can follow up with you. Please know, I understand this is a big problem that we need to get to the bottom of. And so we do look at every opportunity we can to make sure that expectations are being shared with you and that we've got some good contacts that you can get in touch with when something doesn't go as planned.
Oh, I'm just curious, are there feedback loops in place where you can get this information? I mean, just to put it into perspective, like with my business, I get every email that a customer sends. So I know, even though it's not to me, it's to my customer service department, I get CC'd on it. So I understand the issues of what's happening, and I can see immediately if we're doing a good job or not. Is there anything at the VA or at the Idaho level where we get this feedback?
I would say that we have a lot of opportunity in the hospital to see where these things are not working well for veterans. We've got Rachel here with our patient experience office. We have a team of patient advocates that will answer return calls, look into individual things, and they'll elevate reasons things are being delayed that don't necessarily have to be, or we could do something different. So we've got those systems in place. Our staff throughout the hospital too, if they collect comments from veterans or if veterans share something, it goes to teams so that somebody will address it. But there can be a number of things that impact that. Yeah. I would just say that we've got a lot of individual cells that handle different pieces of it, and we're looking at ways that we can make that easier for folks to navigate so that you get that response when you expect it, and you have a single point of contact for those things, because that gets tricky too.
Thank you. Sir?
My name is Tony Marvella. I spent 20 years in the Air Force, and I appreciate all of you coming this evening as a resource. And if we have a problem, depending on which area it is, I appreciate the information that you've been giving us. My question is there a source, a website, or somewhere we can go to just read about our benefits? I know I will speak to people sometimes and they'll say, did you know that you can go to an emergency room 4 times a year and get treated? I didn't know that. So I'm wondering, is there a place you can go to that you can just read through and you can go, wow, I didn't know I could do that, or I didn't know this was available to me? Thank you.
Is there anything where, I know there's different levels of service that's provided, whereas a veteran has an established service level, it kind of all encompasses that service level, or is it really just at an individual basis? It just depends.
I'm just going to say, I think it comes down to each veteran is individual, just as we are as human beings, and it depends, unfortunately. But Trey's right, va.gov, I make it a point to get on there myself once a week and look at a different section and learn about what's going on, because I don't know what all the resources are myself. But it's a very good website, and things are broken down very well. It's got a search engine on it, so if you're looking for specific things, maybe about, the Spokane hospital, it'll pull up that, and you can see all the different things that they have, and click on that and go in. So if you've got the time, that's probably your best site, va.gov.
So, and if I could real quick, because the mayor kind of touched on this earlier, that there's like kind of a go-to person that you can call who can kind of be an advocate for you. So where is that person again that they would call? And for those watching at home, who would that person be?
Patient advocate?
A patient advocate, somebody that you can start with.
509-434-7504. That is the chief right up there, right here. So you could ask her all those questions.
Yeah, our office is willing to help on basically everything you guys touched on. We might not have the answer right away, but we are plugged in and we can find you the answer. Also, in regards to your question, our facility recently started a new patient orientation class. So you don't have to be a new patient to attend. I believe it's offered virtually as well, because you're going to have services offered by the VA, but every medical center is going to have, that goes over what we offer at Maine Grant Staff VA specifically, and it will give you specific local numbers. So even though, you know, you guys are North Idaho, we still service you. So you can still call the patient advocate office in Spokane, and we will still help you find the answers.
And can you give me that phone number again, please?
509-434-7504.
So that number that the veterans should be calling is 509-434-7504. 509-434-7504. And that's a good place to start.
Yes, sir.
To determine benefits, to see what other benefits they may be eligible for.
If you want to determine benefits, you're going to talk to Trey.
Okay. They are, if you got a complaint about something that's going on, you would call them.
That's the patient advocate line.
And just say, if you didn't get a call back from somebody you were looking for, you would call a patient advocate. After a period of time, you say, hey, what happened? They will do what they call a PAX. They will send it out to the service. The service, I know I get a lot of them. And so what happens is, we'll answer the PAX saying what happened, and, you know, just say, you didn't get a call back from us, and we've called you earlier, or something like that. That will go to them. For the eligibility part of the VA, that is me at 509-434-7009.
All right, well, you're the guy I want to talk to anyhow, because you're the one who's going to bust doors down for the veterans, all right?
Hey, I'm probably retiring pretty soon, so don't let them push it too hard.
All right, well, we'll get a young guy to do that. But for eligibility, it's 509-434-7009.
That is the eligibility department at the VA, and we'll be glad to help you.
And that's to help.
Just like this guy right here, let me tell y'all, you see this book right here? I brought some of these up here. These tell you everything about the VA. Okay, this is y'all see the year 2004. You got to remember the government's always 1 year behind. So we had 2003. I'm waiting till we get money to buy some more of these, but we've made them up. But these books have everything that talks about whatever we're talking about in here. It has it already in here. You can go online and get these books. If you want to call me, I can actually email the book to your, not to your house or whatever you want me to do. But this is what we give out. We pass this out to the veteran. So you won't be saying, I don't know nothing about the VA. It's all in here. It talks about from one thing to another. It's even got, they all in color, y'all, for all the Army people. So, okay? So this is what you need to look at. It talks about everything about the VA.
All right, so for VA eligibility,
Yes.
509-434-7009.
Yes, sir.
All right, so let's go back to the veterans home. Does that offer rehab stays and services like that?
So if you have, for example, if you break a hip and you need long-term rehab, you are eligible to come there because we do have therapy services inpatient to help you get back up to speed so you can go home.
Okay, and then, so people actually do go home?
Yeah.
They don't stay there?
The majority of people, it becomes their home until they have a celestial discharge. However, there are people who do come for short-term rehab and then go home.
What percentage would you say?
Across all 4 of our veterans' homes, I mean, I would.
Post Falls.
Post Falls, we have not had just a short-term rehab stay like that, but we do offer those services. A lot of times, once somebody moves in, more likely than not, the family, the break that they're getting in those care, because it's hard being a caretaker, and regardless if you're in a hospital setting, in a skilled nursing home, or at home, sometimes you need that break because you've been giving so much care that you don't realize how exhausting it has been on you. And that's why we're trained to provide those services for your loved one.
Okay. So, and can you just kind of describe how the veteran home is different from like a regular nursing home?
So the veterans home is different than a regular nursing home. In most regular nursing homes, your population is predominantly female. In a veterans home, the population is predominantly male, and it's predominantly veterans. So in our veterans home up here in Post Falls, 4 of our residents are females, And so it's a very small population compared to our male demographics.
Okay.
And so it's veteran-centric, and so you have that camaraderie with your brothers, and we do different activities based off of what your interests are. And so for our model is we try to make it a person-centered care approach, so we look at everybody as an individual, not as a population, and we cater your care based off of what you need, whether it's from activities, social services, your medical provider. We have all of that in-house to make sure that you have that full care package, so you don't necessarily have to go outside for your care needs except for those specialty appointments and stuff.
Okay. Thank you.
I would add real quick, one of the other major differences is we provide a much higher and better level of care than most non-veteran homes, and that's backed up by lots of data and surveys. So we pride ourselves in the high level of service that we provide to our veterans and our residents.
Yeah, and that's a big deal.
Yep.
So,
We're currently a 5-star facility based off of CMS ratings, and which is really great. And then all 4 of the veterans homes in Idaho were recognized as the top 15% of nursing homes nationwide for the care that we provide to our veterans, because we make sure that we are providing that superior care, because we wouldn't have the jobs or the life that we have without the freedom that you guys have sacrificed so much to give to us. And so we take pride in providing that care back to you.
Mitzi, did you want to add to that?
Yeah, I just wanted to say I've visited all 4 of our veterans' homes across the state. I've been in other nursing homes speaking with veterans, but when you walk into one of our state veterans' homes, I never use that word nursing in front of it because it really truly is a home. There's not that antiseptic smell. It's very clean, obviously, but there's just laughter and camaraderie. And I know several veterans that, they were never going to go to a nursing home, and they ended up at one of our facilities kicking and screaming. And within a very, very short period of time, they're like, I'm never leaving here. And that, whether it's our Mercedes-Benz model here in Post Falls or one of our other homes, that camaraderie that they had in the military, they rediscover that, which is just a beautiful thing, especially at that point in their life, and with decreasing health. And if you haven't visited the facility, you should call Amber and make an appointment and go in and check it out. And they always need volunteers also.
Yes, we do.
Thank you. Okay, let's move on to the cemetery. Jake?
Yeah, I'm still here. Yeah.
What is the Burial Equity Act?
So the Burial Equity Act was passed, was it 2020, 2021, to allow the interment of guardsmen and reservists that did like a 6-year initial enlistment, never deployed, but weren't, as somebody brought up before, they didn't have the same rights as veterans do, and they don't carry that veteran status. So the Burial Equity Act was passed nationally and then given to the states to pass. Idaho, we passed ours last year and started interring guardsmen and reservists that met their enlistment of 6 years with an honorable discharge. And the only difference between that is they don't have that veteran status unless they do have a service-connected disability. Most, if they were to go talk to Scott, would probably get that. But until they get that, they're just a guardsman or reservist, and they don't meet that veteran status, so the VA does not reimburse the state cemeteries for their interment. They allow us to inter the guardsmen and reservists. However, that's the cost to the families. So it's that $978 that I spoke of earlier to the spousal's interment, same fee to the guardsmen and reservists. However, they also have to pay for the marker. So for the upright marker in the state of Idaho, we charge $400, and then for all the other markers, whether it's a columbarium niche, a memorial marker, it's $250.
Okay, and can you reserve a burial plot?
You cannot reserve a burial plot. The only time we reserve a burial plot, like we spoke with earlier with a dual veteran status, if both the spouses are veterans, we save the plot next to them. If they let us know that they're both veterans and they want separate plots, it makes it a lot easier if we know the time of the first interment that we save the plot next, not when the second one passes away 20 years later and we have to move the first one to get that extra spot. Or if there's an eligible dependent, like if one of my childs were to pass away, I can save a spot next to them for when I eventually pass away. But no saving and no locking in the rates.
And does one need a VA disability rating in order to qualify for a burial benefit?
No, just veteran status.
Just veteran status, okay. All right, we're gonna shift around here a little bit. Healthcare, again, these are questions that were provided last week. Why do glasses take 8 to 10 weeks to be delivered?
Thanks for providing that feedback. We actually have an optical lab that works with us out of Boise. They have a lot of systems in place to track that for us and respond when we're hearing that those timeframes are extended beyond what we would expect. Usually, if there's been an issue in the past, they can tell us, hey, we're working to mitigate this thing. We expect another few weeks, and we can kind of manage expectations up front. But sometimes there's things that happen within the optical shop that impact that. They're all sourced from that spot, and so we have to partner with them to figure out if there's something that longer term is going to delay things for folks. But if you have an issue with that, we can certainly help look into it. They offer tracking information. There's a number of ways that we can dig in on those things.
Yeah, okay.
I'd like to speak to you after.
Yeah.
Patient advocate right there.
All right.
I'll let her look at the witness.
All right, this one's going to touch on what Mr. Thornton said earlier. Could you talk about plans for mental health in rural areas of the state? Any hope of getting peer support or skill building resources?
Trying to think of who might have the most up-to-date information on that. There's a number of different ways that we can accommodate needs that happen in rural communities. But I get a sense that we want to look at what's coming in the future. And I don't know that I've got somebody here tonight that can speak to that, but we can certainly take that question unless anybody here is aware of something they want to share.
Well, I think I'd like to add something
Yeah.
real quick, and that is, as great and wonderful as the VA is, it's never going to be able to meet every need in every area of every location. And that's why I think what Hank Thornton has done in St. Mary's is such a fantastic model. And what we're really trying to do is with Hank, trying to replicate that in other rural areas where the community comes together and offers some of those services that they may not be able to get through the VA because the VA cannot be everywhere. So for example, like providing assist training where we train volunteers to be crisis intervention individuals, where we set up a veteran outreach center where a veteran can come if they're in crisis and talk to a fellow veteran and receive help. Those are the types of programs where we collectively as a veteran community can come together and fill those gaps, because again, if we wait for the federal government to do that for us, we're going to be waiting for the rest of our lives. It's just not possible. But again, the beauty of what we're doing here today and a lot of the folks that are sitting here is it's the community coming together, identifying that there's a gap, and then pooling resources and personnel to fill those gaps. The other thing that we have started through IDVS is a program called Veterans Talking to Veterans. And these are trained coaches is what they say, but they can actually get their credentialing as counselors as well. But these are veterans who are trained and they do group sections. It's not peer-to-peer per se, but it's actual trauma-informed coaching is what they call it. And we've got 5 different groups. And who's our Northern Idaho rep?
Her name's Michelle Rasmussen. She's up in Athol.
Yeah. So they're establishing either weekly or bi-weekly groups where veterans can join in, talk with one another, and establish that peer support with one another. And we're trying to expand that program. We've got it throughout Idaho, but we want to grow the number of coaches that we have that are trained to do that. And again, that's just another way where we recognize the area of mental health and our ability to provide those services to our veteran members that need it is overwhelming. And again, it's one of those areas where we're trying to think of outside the box ways that we can get together as a community and kind of fill those holes. Again, usually with volunteers, usually with no overhead or cost. We're footing the cost for actually providing training to the individuals who are willing to volunteer their time to run those groups. But again, we're always looking for people to stand up and say, hey, I want to help within my community, and I have time, and I have the ability to do that, and I want to help my fellow veterans. So again, we can't rely on the VA to fill every hole that we have. We're going to have to do some of that ourselves. And again, we're here as an organization to help you do that, to help facilitate that. We got great partners like Hank who have done it on their own and can help you do it in your community as well.
Mark, Commissioner, if I may add one thing that adds to exactly what you just said that works wherever you're at, is the 988 Crisis Lifeline. You can text or call that number wherever you're at any time, and they will not only talk to you or help you, they will follow up with a care support team that will contact you directly from the VA if you're a veteran within 24 hours. 988. Thank you.
Option one.
So,
Thank you.
my name's Eric Brunowski. I work for Kootenai County DMV. One thing that I learned from my friend, actually, he randomly called me and was like, hey, did you ever hear about this Warrior Path? And I was like, no, what is that? And he goes, you should check it out. I'm going tomorrow. And I was like, okay. So then I looked it up, and it's a peer-guided program. Veterans like us, it's open to military first responders, military, whether you're a combat vet or not, it doesn't matter. It's run by Boulder Crest. They do have a facility in Port Orchard. They will ship you there for free. You get mental health and help like that, then you gain friends and camaraderie. I have 10 guys that were in my group. I can call any one of them at any time of the day and talk to them about anything, and they will answer the phone no matter what. They are going to open a facility here in Coeur d'Alene this August. Is the first class on Lake Coeur d'Alene. They're trying to get equine set up, so I talked to some of the equine people at the stand down, so I sent them that information, stuff like that. But the biggest support I would say for us is each other. You find out something new, you share it, right? You see your friends at these legions, the American Legion, the VFW, all that stuff, be like, hey, I just heard about hearing aids to take care of your tinnitus. Okay, I had no idea until one of my friends told me that it would take care of my tinnitus. And I was like, okay, why are you wearing hearing aids? Because it's for tinnitus, bro. And I was like, okay, really? You know, but it works.
Yep.
Mind blown. And then I heard from another friend that I went to Marcus Institute for Brain Health. If you got TBIs and stuff like that, it's the greatest thing since sliced bread. I tell you, it's all free to the veteran. And then they set me up with a patient advocate for Macy. I have no idea who she is. I've never met her in my life. But I tell you, I will contact her, write her an email, and she answers me back in 3 hours. And it is quick. And she gets me the services that I need, whether it be glasses, hearing aids. I have a neurosurgeon consult coming up, stuff like that. And hey, if it's not moving fast enough, call your patient advocate. If you're not getting services, call them. That's what they're there for.
Thank you.
Thank you. All right. How does VA healthcare coordinate with private insurance, Medicare? Does it?
Trey, I think you'd be best at explaining this.
Come on down, Trey. I got your name now.
Okay, the VA and Medicare are like apples and oranges. They don't mix. The VA is VA, Medicare is Medicare. The only thing we're required to do by law is collect any insurance you have, but the VA will never bill Medicare because one federal agency cannot bill another one. So the best Oh, I thought that was my answer. My phone do that too.
What about private insurance?
We can build private insurance. That's, okay. The guy asked to go how the VA gets money. I'm gonna tell you a story. I hate to tell you a story. Story a long time ago, everybody used to get what we call a 1010 EZR from the VA to send about your financial information. Everybody remember that? Yep. And then the VA stopped it. That was how they collected your insurance, how they collected, making sure everything was correct on the system. During that period of time, it cost a lot of money, so they decided to figure out to do it off your taxes. So a lot of you don't fill out tax information. So right now, currently, we probably got some old information on veterans in that system. The billing system, I hate to say it, was screwed up a little bit at one time. During that period of time, was screwed up, and then the billing system started coming out. Then we got COVID. So 2 years, was it 2 years? 2 years? We didn't not get no bills at all. Nothing was come out. Now, as of October 1st, everybody in the world is getting bills. And you coming back yelling at us, but the catch of it was, we're looking at old information. When you call me, I will send you a means test out to update that information. One, we can bill your private insurance if we can. We cannot bill Medicare, but we can bill your private insurance on some conditions. That's one way we get our money, besides how many veterans we get in. Yes, we get we get so much money for each veteran that's coming in. The more veterans we got in, the more money we get every year. We can project how much more we can do for you. That's why my biggest issue is with you veterans out here, because I can say you veteran because I'm a veteran myself. We didn't register. You didn't do nothing. So now everybody's coming into the VA trying to get us to do everything, and we have a set budget for this year, and we are already probably over the budget right now. I don't know, I'm just guessing. And we're still trying to take care of our veterans. So that's why I beg you, beg your friend, beg anybody you see out there when they talk bad, go to the VA, get in the system. Even if you get in the system and you're not accepted right then, we can make sure it happens later on. But you will be able to get more money for our VA to grow. The more we grow, the more stuff you'll be able to get in North Idaho, every place else we got. So this is all on all you veterans. And I'll put it back there because I'm a veteran too. Yes, at one time I didn't use the VA. And then I realized, I said, golly, I am making sure I'm hurting my other veterans. Even if you service connected, you don't want to be just seeing once a year. But guess what? We'll get some extra money because you just came to see a doctor once a year. We used to call it vesting, but we don't call it that no more. But you just come in and see the doctor, then we get more money, and then we can help another vet. So you look at it this way. The more you come in here, see that you help another vet to get his care. So think about that. Think about what you need to do for the other vet, not for yourself, for the other vet. I have no politics. I just speak for the vet. I can't say no more again.
Thank you, Trey. What kind of caregiver support is available to veterans receiving VA health care?
Brett, what's the best resource to direct folks to? Because that's a great question.
Hold on, Brett. We're going to look right behind you.
Thank you, sir. Thank you, Sarah. Yes, we do have a caregiver support program at the Spokane VA Medical Center. In fact, they have an annual conference for caregivers, whether you're helping care for that veteran at home or in a facility out in the public at large. But we do know that, I don't know the specific phone number for our caregiver support team, but we do publish a monthly newsletter that we can have available to you if you'd like to request it afterwards, or we can put it online. We do circulate that through our internal system, but we have a very robust caregiver support team that's tied with our social work team, and then ultimately tied and overseen really by Rachel and her team with our patient advocate department to make sure everything's in sync for caregiver support. And there's certainly some legislation and national new laws in recent years that have given more options and some better benefits for caregivers at home. I'm not up to speed on all of that, but it is available, as the mayor said, va.gov. Thank you.
Thank you. Does anyone else want to add to that?
I was going to say, recently, the federal government has passed the Elizabeth Dole Act, and that act specifically has a ton of additional resources for caregivers. So again, if you just Google that and read that, and again, a lot of those things, it is passed, but again, it hasn't gotten to the point, I think, where the VA has actually implemented it in action yet. So if you, again, Google the Elizabeth Dole Act and actually read the additional caregiver services that are in that act, they're pretty significant. And a lot more stuff is coming down the pipe for caregivers.
Thank you. Another question here. Is it better to pay someone to file the VA claim, or is using services?
No.
No. Nobody should ever have to pay for your VA benefits to be applied for.
Go see Scott.
Go see Scott. 100% free. And not only that,
He's good.
He won't screw it up. He'll make sure it's done right.
Try not to.
He'll make sure that you get your benefits.
He's really good.
If somebody comes up to you and says, I guarantee you 100% disability, you run the other way, because not only are they not going to get you 100% disability, they're going to take the majority of it as a fee. Do not fall for it. Don't let your fellow veterans fall for it. It should cost you nothing. Go see Scott or any one of our other service officers across the state.
All right, so the answer is no. Don't use a private person. Okay, if you've been scheduled for one CNP exam, why does the VA come back later and schedule for another CNP exam? Looks like extra VA expense.
I'll try to answer that one. So whenever the VA, we as VSOs, Veteran Service Officers, we develop a claim. We help you put a claim together and we submit it. Well, when the VA gets it, they have to develop the claim. They have to collect information to see about supporting your claim condition. One of those pieces of developing the claim is a compensation and pension exam. So I always say it's kind of like a sports physical. Sir, lift your elbow, how far can you move your arm, right? Well, there are times, and it's not super common, there are times when they go to an exam, the examiner, in most cases, didn't properly complete the exam. They did not cross an I, dot an I, cross a T where it was supposed to be crossed, and they have to reaccomplish the exam. Whenever the VA asks questions, the VBA, the claims, they're typically not doing it to be against you. They're actually looking for ways to service connect you. And if they feel something's missing, they want to make sure they have every piece of information to be able to properly give you an accurate decision. Decision's not always in our favor, right? But it's accurate to the best of their ability. So that's why sometimes it'll cause a second CNP exam. It's because the first one wasn't, in their eyes, wasn't complete or thorough enough.
Sir, did you have a question?
Yes, I do. For the people that don't know who I am, consider yourself lucky. I'm Leroy, known as Davy Crockett. The answer you just gave, I liked it, except for one thing. I went and had they call them VESs now, Veterans Evaluation.
That's one of the contractors.
Right,
There's
right.
four contractors in this area.
I went there, directed to go there. I had a defibrillator put in my chest, okay? I was assuming, in the way she was talking, this was my last step to evaluate my claim. Before I left there, I mean, I've already got it in my chest. I have to go get another ultrasound.
To
What
confirm
what
you
was that
have one?
ultrasound going to do? Take it out of my chest? No, it's not going to. It's still going to be there. Never did get an explanation.
I can't give you a direct answer on that, but as we know, even all the examiners are human,
Yeah, right.
and they can make mistakes.
Right.
If that was a mistake,
Yeah.
or that examiner felt that needed to be done for any kind of recourse to make sure that the exam was completed in their eyes. You and I go to an exam and we're just kind of mules, right? We do what they tell us to do because we don't know what the exam is totally going to entail in whatever aspect. I can't answer if that was the right call on her part.
Okay.
Or if it was. It may have been. Or it may have been, you know what, that was a waste of time. One thing about CNP exams, for the most part, do them.
Right, yeah, got it.
Don't miss them. Go to them. Even if this really seems dumb, right? Go to your exam, play the part, because the VA is still, that's one of the primary aspects of developing your claim for them to give a decision. So it's one of those, sometimes we just got to play ball, even though it doesn't make sense.
No, it does, because it extends it out longer.
It can,
Claim.
or it can extend it out longer if you don't go, because if you
Well, no,
don't.
I'm talking about, I went, but when they turn around and say, now you need to go get an ultrasound, well, that extends my claim out more. I've already got this in my chest. This was what the claim was for.
Right.
Because I had this put in my chest. And now I need to go get an ultrasound. And I'm thinking, I came here, I did the test, whatever she wanted me to do, talk to me. And then when I leave, she says, oh, you need to go get an ultrasound. I'm going, oh, okay.
You'll,
Pardon?
That may end up being to your benefit later on.
Well, the way it was explained to me, once you put this in your chest, there is not a lot of questions left to ask as far as getting a claim on a defibrillator. There's not a lot of questions left to ask, so.
right, and to confuse a point, to confuse a point some more, but it's actually not confusing, you will file for one condition, and you may find out you get 3 CNP exams for that condition. Because the VA says, okay, you're filing for this, but these other issues could also be being caused by that condition. They're looking for additional things they can service connect you for.
Well, I'm already 70%.
With a defibrillator,
I've had open heart surgery, I've had all of it. And then they put this in after the open heart surgery, so I figured if I needed this, I went and got it. I'm thinking, it's gonna extend the claim process out longer. That's basically all it's gonna do. And if they find something else, fine. I went there, the claim is for this.
right, and it does stink when claims take so long. The beauty of this process is whether they take 1 month or 10 months, you get the back pay, right? So you're not being penalized by them taking too long, and sometimes it's unfortunate they do. You know, but right now, in the average claim, you can go onto va.gov and go, or just go to Google and type in VA average claim, and it bounces around 130 to 150 days-ish. That's for, but what people don't focus on is the word average. Your claim might get done in a month, it might take 13 months, but the huge majority are completed in that 4 to 6 month window. That's where probably 80% of claims are completed. But, so it's, yes, thankfully, we veterans went to the military, and what was one of the first things they taught us? Hurry up and wait. Right, and so.
Is that from the date of the letter of intent?
No, that's from the date they receive your actual claim. Right, because then now they actually have something to work on. So it's whatever the date is, today it's probably 142.3 days, but it's just an average.
Scott, is this where a patient advocate could help in trying to answer these questions?
My answer would probably be no, because just like Mitzi said in the very beginning, there are 3 departments in the VA, right? There's the VCA Cemetery, VHA Health, VBA Benefits. So, and the VA typically is really good at staying in their lanes. So a VHA person cannot tell, in a sense, the VBA to hurry up, right? It's a different department. Just like you were in the Army and I was in the Air Force. We're 2 separate departments of the DOD, right? We both have the same ID card, you know, all that, but we are separate departments with our own separate systems. The VA is built the same way. So that's why when people come into my office and said, I was talking to the VA, I have to say, who? Well, I was talking to my nurse. Oh, now I know they're talking to the VHA, who doesn't have often a good understanding of disability claims, right? So now I know how to talk to the vet and maybe clarify some issues. So that's always a good thing to get, is have the veteran understand the different lanes of the VA so they know who to talk to and when they're dealing. It's no good calling your nurse about filing a claim. No good calling the VBA about getting a medical appointment, right? So,
All right.
And CMP exams are never done by the VA, they're always done by an independent contractor.
99% of the time.
Okay. Well, we're getting close to wrapping up here, so I got a couple more quick questions. What can veterans and the public do to support the Idaho Division of Veterans Services and the Veterans Administration? What can we do to support you?
Do you want to go first? Okay. You can support us by continuing to partner with us. Again, things like joining forces, which Mitzi heads up, any of the programs that we got that are community-based, help us establish more veteran outreach centers in rural areas. Our goal really is to make sure that every veteran and their family has access to services. And the only way that we are able to do that is by partnering with the community and partnering with our fellow veterans out in the community. Because honestly, we don't have SHIT for a budget. And most of what we're able to accomplish is because we're partnering with you guys in the community to do that. So continue to partner with us, continue to help us, continue to bring your needs to us. Because again, we want to know what are your needs and where are those needs at? And then we're going to sit down, we're going to work with you to figure out how we can meet that need. Because again, it's great if the federal government could give us some benefits. It's great if the federal government can give us some health care. But ultimately, there's going to be a lot of things that they cannot do for us. And then it's going to fall on us to really step up and take care of one another. So partner with us so that we can continue to do that.
Thank you. And then the last question. Does anyone think that there's new opportunities with the new leadership at the VA, Secretary Doug Collins, and taking where he wants to take the VA?
Oh, I'd love to talk about that one.
Okay, Mark.
So actually, I got the unique experience a little over a month ago to actually meet with the new VA Secretary, Secretary Doug Collins, and talk to him a little bit about the future of the VA and where it's going. And I will first tell you that for the first time in a very long time, I'm excited about where I think things are going to go. And I'll tell you why. Number one, your new VA Secretary is a veteran. He's a veteran. And not only is he a veteran, he's been deployed to Iraq. And not only was he deployed, he's a chaplain. And not only is he a chaplain, he also used to be a former congressman in DC. So what you've got is an individual who understands the game very well, but is also one of us, a veteran. And in my conversation with the VA Secretary, he made a couple things very, very clear. And one of those things is he is here to take care of veterans. So whatever rumors and innuendos and gossip that is going out and about, hey, he's gonna fire everybody in the VA and there's gonna be nobody to take care of us, completely false. He is here to transform the VA to be more effective, more efficient, and to actually put more money into the VA to take care of us. And they've already executed on that. If you go and you look at the budget that has been recommended by President Trump, you will see that one of only 2 areas where the budget is increasing is in the VA. And the money that they want to increase is for fighting homelessness and increasing health care within the VA. And again, it's one of the only federal government agencies that they're actually recommending an increase in funding for, not a decrease in funding for. So he's putting his money where his mouth is, and he's putting veterans first. Now, are they going to change the VA? Yes. They're actively looking for ways to improve efficiency. And that may mean that, they're going to adjust, right, the VA system, and I'll let you maybe talk a little bit about it, Sarah, but we're broken up into VISNs, so we're broken up into regions. And one of the ways they're looking at maybe increasing some efficiencies is combining some of those VISNs, combining some of those regions together so that the resources that are available there are more efficient. There's also, you know, and again, I'm speaking from my own experience working with the VA, and again, I don't work for the VA, but I have to work with the VA. At the higher level, not the ground level where you guys are getting your care, but at the higher level, so we'll call it the central office of VA, they are so thick with bureaucratic level after bureaucratic level after bureaucratic level that it literally takes at least 3 years to enact a change through the VA, because it literally has to go through 12 different levels of leadership to get approved, and that's not including the 12 different lawyers that have to review it. So what Secretary Collins has basically assured us that he's doing is he's going to reduce that bureaucracy. He's going to reduce that overhead that doesn't need to be there, that does not provide direct patient care to veterans, and take the money that he saves from that and put it back into the programs that do help veterans. And one of those areas is expanding community care. There are a lot of questions where, why does it take so long for me to get an appointment? Why can't I get an appointment where I live in a rural area? Those are the things that he's well aware of because he's a veteran himself and is really working hard to try and redirect funds to those areas to expand community care, to expand transportation opportunities for rural areas, to expand telehealth, to make sure that we can reach into more rural areas. He's focused on the right things, and he's doing a lot of the right things. So I'm super excited by where he's taken things. It's going to take a little bit of time to work through that. And Sarah, you could probably talk about, you know, maybe some of the directions that have been brought down from higher level VA in terms of look at your system. Where can we find efficiencies? Where can we maybe cut out some steps that we don't need? And then turn around and put that money right back into our actual care. So I'll leave it with that, but I'm super excited with where things are going. I'm super excited to have a VA secretary that's actually a veteran for a change, because he gets it, he understands it, and he's going to work really hard for us, I believe.
Did you want to add anything, Sarah?
Yeah. Kind of touches on both of the recent questions. I would say if there's anything that we can do to work best together, it's please share your feedback with us. If you have an experience that goes wrong, if something's not going as expected, there is a place that can receive that and help. Those types of things lead us to a place where we're looking for change in a process that doesn't make sense, that doesn't add value. If it's questions about an ambulance, maybe there's something we do at a higher level. I see no reason to think that there's anything but a hopeful future for the services that are available to veterans. You've certainly got people at all levels in the organization that want to help get there, that have different experiences doing it. For everything that was suggested, it just looks like a bright future, even if we can't fully picture what that looks like yet. We've got a number of different projects happening at the medical center and at our different sites. So there's continued investment in making sure that we're able to provide the best health care to folks. We're expanding our MRI capability. We're working on an expansion in our community living center on campus that allows for individual beds. We're just adding a number of different improvements. So every time there's a request that has a direct impact on veterans, there's a quick response and a real steadfast commitment to get this right for everybody.
Thank you. Jake, Mitzi, Sarah, Mark, Amber, Scott, is there anything that you would like to add before we wrap it up tonight?
I think I'll just mention, we've talked a lot about veteran status, and for the VA, there are certain criteria to be considered a veteran. Again, I believe that anyone who signed their name on the dotted line and were willing to give their life for our country and served is a veteran, and that includes our guardsmen and reservists. And if they don't fit in to one of these other services, again, if they're in need, I'm going to figure out a way to assist them. So that's my definition of a veteran, and we need to help them because they sign their name on the dotted line, just like everyone else.
Anybody else?
I got a couple things. I came here for a specific question that didn't get asked, and I'm going to answer that here in a minute. But having worked at the VA, I've been in travel, I've been at voluntary service, I understand the complexity, and she may hold the title as patient advocate, but the question about how can they help us is everybody in this room is a patient advocate. I saw it every day working at the front desk at the VA hospital. It requires you, as the veteran, to be a patient advocate for yourself, ask the question as Scott was talking, and as many of you have mentioned before, these different groups and finding out different resources, and Google, for all the different things about Google, it answers just about everything, and you gotta be careful about what you're reading, but verify that information and bring it to your VBA, your American Legion, your VFW post, and talk with your other patient advocates. In regards to the question I came here for, are we ever going to build an Idaho State Veterans Cemetery in the north? Yes. There are some complexities to it. The VA will not provide the grant funding to do that because we already have Medical Lake nearby and Montana. However, in the gray area, where I like to operate, the Idaho State can establish a veteran cemetery, and what that looks like, we're working through the fine details of that. But if we get land donated to us, and we establish our own veteran cemetery here, then I could go to the VA and ask for an expansion grant. We have our established veteran cemetery that the state funded, and then we can ask the VA to help fund the expansion of it. So yes, we are looking for properties. There's some intricacies that come with that. We can't build a cemetery next to a railroad track or next to the ball field or anything like that. But if you know of appropriate property that's not on the side of a hill, that's not an island on the lake, talk to us. Jason's going around, he's gonna be looking for it. I plan a summer vacation to come up here and take a look at different areas. Tomorrow we're going with Hank over to St. Mary's, and that's something that keeps popping up as a central location that everybody in northern Idaho can get to. But if you have ideas and suggestions, bring it forth. We're here to hear it. We want to build it. We've talked about it since I've came on. It's just a matter of navigating that gray area and finding funding for it. But I've gotten pretty good at finding funding for it outside of the state or federal stuff. So just bring it up, ask the question, and let me know. I'll work with you.
Yep. Thank you. Well, I think the number one takeaway is that if you're a veteran, start today on establishing your eligibility. Call Trey, call 509-434-7009. We're going to have a bunch of important numbers I'd like to put at the end of this video and one of the cards so people can access these numbers. They know who to contact. And with that, I also want to give a big thanks to our panel for especially those who traveled along a great distance to be here, and for your time and for making yourself available to answer, in some cases, some difficult questions. So thank you very much. Appreciate it. And with that, we will conclude this evening's event. Thank you all for being here.